Welcome to Strike Stroke. My name is Dr. Mekdes. Today we're going to talk about patent foramen ovale related stroke. So to understand how PFO causes stroke, we must first understand what happens when we are in utero or in our mother's womb. So let's understand fetal circulation for us to understand what patent foramen ovale is and how it causes stroke in an adult. So when we are in our mother's womb, we are not breathing. So our lungs are collapsed because we cannot breathe underwater, unfortunately. And our liver is also immature, and our kidneys don't filter our blood either. So who or what organ helps us filter our blood? In this case, the placenta. It serves as the fetus lung, liver, and kidney. We receive nutrition-rich, oxygen-rich blood from our mother, and this oxygenation or nutrition exchange occurs at the placenta. So the placenta acts like a filter. From the placenta through the umbilical vein, we have this red, rich with oxygen nutrient going into the bottom portion of the right atrium through the inferior vena cava. From there, it goes into the right atrium. The blood needs to bypass the lungs, so there's a shunt system called Foramen Ovale where the blood would go from the right atrium into the left atrium, entering systemic circulation. From there, it goes into the left ventricle. From the left ventricle, it gets pumped through the systemic circulation, perfusing the brain and the rest of the body. And once the child is delivered at term, at this point, the child will take their first breath. When this happens, the lungs will expand. When the lungs expand, pressure gradients change within the chest cavity or intrathoracic in the heart as well. This change in gradient will lead to closure of the foramen ovale. Then the fetus heart will look more like an adult heart. In this case, the venous circulation and the arterial circulation will become separate. Now, the closure of the foramen ovale actually does not happen in about 20% of the population, hence the term patent foramen ovale. So how does having a patent foramen ovale cause an issue? Because we just talked about that 1 out of 4 individual will have a patent foramen ovale. So that means if there's a family of 4, 1 of them will have a patent foramen ovale. So it's very common. 20% of the population have this. So why is it a big deal when it comes to stroke? Under certain scenarios where we produce this increase in right atrial pressure, if this foramen ovale is still patent, we can open this flap and make it functional. Things from the right atrium can move into the left atrium, and we don't want that to happen because now we have moved from the venous circulation into the arterial circulation. It can move into the brain and cause an embolic stroke. Some scenarios that will cause this is coughing, sneezing, Valsalva. When we bear down, we are increasing that thoracic pressure, increasing the right atrial pressure. We're making this flap functional and making things move from the right to left, causing an increased right to left shunting. These are intermittent scenarios where the patent foramen ovale becomes functional, but it can be continuous. In that instant, the person could have increased lung pressure like obstructive sleep apnea or chronic lung disease where the lungs are just strong because the lung is a low pressure system. But if you have chronic lung disease, you can actually increase the pressure within the lungs that can transfer into the heart, and you can make this patent foramen ovale, if you have it, become more functional at a continuous basis. Sometimes the shunt can be small. If you have a large patent foramen ovale that's functional or continuously functional, that increases your chance of having a stroke. So let's just paint a scenario where an individual could have a stroke. So let's say this individual took a long trip, developed a clot in their leg, and this deep venous thrombosis then travels up and goes into the inferior vena cava. From there, it enters the right atrium, and if this individual has a large functional patent foramen ovale, from the right atrium, it can move into the left atrium through this functional shunt or PFO and travel to the brain and cause stroke. Another scenario is, yes, they have a clot in their legs, it moved up into the right atrium. At that instant, they were bearing down, increasing the right atrial pressure, which can cause this patent foramen ovale to become functional, and this clot could move into the left atrium and once again enter the systemic circulation and cause a stroke. So when we see a stroke in a young individual, we always have to look at the pattern. We ask questions such as, okay, is this an embolic stroke? Okay, so let's say a 29-year-old came in with this stroke and we're looking at it on MRI and we say, wow, this is an embolic pattern, because every stroke has this characteristic. If it's an embolic pattern, then we try to investigate, where did this clot come from? Could it come from the heart? Could it come from the arteries? In patent foramen ovale case, it's usually a clot that forms in the leg in the venous system, and it travels there and moves over and causes a stroke, hence paradoxical embolism. So when we're investigating, we look at the vessels, so we make sure they don't have any arthrosclerotic disease that can have plaque formation, thrombus formation that can move and cause an embolic stroke pattern. We also look at the heart. We do an echocardiogram looking at the heart function itself, make sure there's no weak muscle, the person did not have a heart attack that causes them to form thrombus on the wall of the heart, which could have moved and caused an embolic stroke. We look at the valves to make sure they don't have a valvular disease or endocarditis, which could have once again moved and caused an embolic pattern stroke in a young individual. So we investigate this. We also look at the heart rhythm to make sure that they don't have irregular heart rhythm such as atrial fibrillation that could have caused to have an embolic stroke. So we make sure all of this have been ruled out before we say that this person had a stroke, which is highly likely due to paradoxical embolism because of the patent foramen ovale. So just because an individual has a patent foramen ovale and an embolic stroke, that doesn't necessarily mean that this patent foramen ovale caused a stroke or was participating in the stroke mechanism. Some of the celebrities you may have heard who had a stroke related to PFO are Justin Bieber's wife, Hailey, as well as Burt Michaels, who are well known. Stroke can happen to anyone. Doesn't matter if you're young, old, rich, or otherwise. In the future episode, we'll talk about the treatment for patent foramen ovale. But thanks for watching. I hope you found this information useful. And the next episode, we'll talk about small vessel disease. And always remember to call 911 if you or someone near you suddenly can't see, can't speak, can't walk, or can't feel. Let the operator know that you or someone near you might be having a stroke, so that you or the individual near you can be transported to the nearby comprehensive or primary stroke center for rapid stroke analysis and tailored treatment.